Hey everybody, I'm Dr. Jason Barker with Rocky Mountain Natural Medicine, and today I want to explain to you why we like to use saliva hormone testing when we're looking for hormonal imbalances. So there's three main reasons. The first one is just a matter of convenience. I can hand you a kit at the end of our visit. You can take that home, you collect the saliva at home. Super convenient, super easy. You mail the saliva with the kit back to the laboratory. They email us the results, we go over them in the office. So super simple in that regard. Second reason is that when we're looking at cortisol in particular, we do not want to send you to a laboratory to sit there and anticipate getting poked in the arm with a very sharp and possibly painful needle. That'll spike your cortisol, that'll give us inaccurate results. And oftentimes when we're looking at cortisol balance, I want to see maybe 2 or maybe even 4 measurements throughout that day of cortisol. So it's just not feasible to have you go to a laboratory and have your arm stuck 4 times like that. So that's second reason why I really like those saliva kits. And then the third reason is that this has to do with just the nature of your hormones in your body, and that is all your hormones that you have are floating around in your bloodstream and they're attached to a little carrier molecule. So in a sense, you're not really using those hormones. You can kind of think of them as being in storage. So what happens when you do need to use them? They, of course, the hormones detach from that little carrier molecule. They exit the bloodstream, they go into your tissues, and they do all of their work. Then when they've been used up, they exit the tissue through the urine or the saliva, and that's why we catch the saliva, so we can kind of look at the functional component or that component of your hormones that your body is actually using. Now this is super useful because when we're looking for hormone imbalances, especially with female hormones, oftentimes ladies will go to their regular doctor and they'll get a blood draw, and the test will come back and say, well, you've got adequate levels of hormones here. And we kind of already know that if you're menstruating. So you need, there's basic levels of hormones you need to achieve menstruation every month, or even if it's irregular or there's some sort of dysfunction with that. So, but what the blood doesn't tell us, it's not really a fine enough tooth comb, so to speak, to look at those imbalances in those hormones. And that's where that saliva test comes in, because when we get those results, like I said, it's a finer tooth comb, it's a sharper lens, so I can actually see what's the difference in that estrogen and progesterone and other hormones that your body's trying to use, and we can adjust your balance of your hormones when we have that information. So I really like it for those reasons. I don't use a saliva test for every hormone, specifically thyroid hormones. And when we're looking at thyroid function, we need to use a blood test for that, and that's just because of the nature of the different types of tests and how those hormones are stored in your body. So you wouldn't expect a saliva test for all the hormones, but oftentimes our patients end up leaving with a saliva kit and an order for a blood draw, so we can look at all those hormones because they function in a big symphony, so we want to look at all of them. So if this sounds like something you're interested in, getting some saliva testing done to look at your hormones, give us a call. Come into the office. We've got 3 naturopathic doctors there that do offer the saliva testing, and we can certainly look at all those hormones and hope to get your body and your hormones back in balance. So thanks for watching, and I'll see you guys again soon. Bye.